One of the most fascinating facts about dermatomyositis is that it's not only a muscle disease, it's also a cutaneous signal of a cancer or autoimmunity. In other words, sometimes the skin tells the story before the muscles do. Dermatomyositis is an idiopathic inflammatory response, inflammatory myopathy characterized by muscle weakness and distinctive skin manifestations. The hallmark skin signs include heliotrope rash, a violet discoloration around the eyelids, so-called Gottron, it's a name, Gottron's papules, scaly, erythematous lesions over the knuckles, shoal sign, photosensitive rash on the upper back and shoulders, but here's where it gets truly interesting. In adults, particularly 50 plus, dermatomyositis can be a paraneoplastic syndrome, meaning the immune response that attacks muscle and skin might actually be triggered by an underlying malignancy. Cancers most commonly associated include ovarian, lung, pancreatic, gastric, and lymphoma. That's why a good clinician doesn't just treat the rash or the muscle weakness. They search what? They search for the hidden tumor, yes. So it's one of those diseases where the skin truly becomes a diagnostic window to what's happening inside. From a pathophysiological perspective, dermatomyositis is characterized by complement-mediated vasculopathy, the deposition of the membrane attack complex C5b9 in the endomyosal capillaries leads to ischemic muscle fiber injury, especially at the periphery of fascials, I don't know how to pronounce correctly, which explains the pattern of muscle damage seen on biopsy. Clinically, patients present with symmetric proximal muscle weakness. They struggle to rise from a chair, comb hair, or climb stairs. Muscle signs like CK, adolase are elevated, and EMG shows myopathic changes. Management involves high-dose corticosteroids, it's all autoimmune disease, immunosuppressive agents, and screening for malignancy. In children, dermatomyositis often lacks a neoplastic link, but can be associated with calcinosis cutis, calcium deposits in soft tissues, which can be disabling. Okay? Stay blessed.